Hello, all. Good morning and good evening. This is the agenda for today. We are on Weekly Connect number 21. We'll start with the Swamiji's session for 20 minutes. After that, we are launching another course. This is named Self-Help Remedies for Back Pain and Other Ortho Issues by one of our eminent Dr. Dr. Mrityunjaya. We'll talk about that for 10 minutes. I'll be running a few slides and few videos, followed by we have received few doubts on the stress part of our course. So we will ask Dr. Susheel to address those questions and then we'll close for it. So it's going to be about an hour session. Interesting three different topics we are going to cover. With this, over to Swamiji for meditation session.
Namaskars, a warm welcome to all our IWSP participants. As we connect every week for our meditation session, let us start our today's meditation session. Sthira Sukham Asanam is the first step. We should have a fixed posture. At the same time, it should be a comfortable one. We are seated in a fresh and neat room which has got a very good ventilation, which is free from sound, noise. We have kept our Ishta Devata's image, our beloved Lord image, or a photo, or just a symbol of Om, or just a Jyoti lamp light. After offering fresh flowers at the feet of the Lord, we have seated with our proper posture for today's meditation. Sthira Sukham Asanam. Place the right palm over the left. Place it between the two thighs. The neck, the back, and the head in the straight line. Eyes closed for the outer world, open for the inner world. Sthula Jagat, Sukshma Jagat, Bahya Jagat, Anta Jagat. Deep within, eyes opened. The focus is on the breath, deep and long breath. Sarala Pranayama. Now, before we go and meditate, let us pray for the wellness of all. When we pray for the wellness of all, we experience a sort of wellness within. That wellness within is very vital for our meditation. The prayer goes like this: may all the beings in the east, in the west, in the north, in the south, above, below, in all the directions, wherever they are, let them be happy, let them be contentful, let them be at peace, let them be in a state of highest wellness, swasthya. By praying for the wellness of all, swasthya, we are experiencing that wellness within. Now let us offer our Sashtanga Pranams to all the sages, saints, rishis, the Avatara Purushas, all the spiritual giants, all the noble people who are constantly working for the welfare of the world. By offering Sashtanga Pranams, we have received their blessings. Blessings are very vital for attaining a success in any given task. Karya Siddhi very much depends on the grace, blessings of the elders and the Lord. Sthira Sukham Asanam, Sarala Pranayama, prayers for the wellness of all, grace, blessings of the elders and the Lord by offering Sashtanga Pranams. Eyes closed for the outer world, open in the inner world. Let us chant Om before we proceed in our meditation. Om is the symbol of God. Om is the eternal sound. Anahata Dhvani, Brahmanada. As we know, this universe came out of a sound, Spota, Big Bang theory. From that sound came this universe, and in this universe we are all living. Our body and mind, along with the soul, individual soul, which constitutes any jiva, any being that we are, this has all come from that spota, anahata dhvani, brahmanada, that Om, Omkara, is the source of everything in this universe. By chanting Om, we get established with that universal self. Prakriti, Purusha are the two words. The nature and the universal soul. When that union is attained, we attain that highest state called Samadhi, Dhyana Samadhi. So, to attain a state of dhyana, meditation, we have to chant Om. When we chant Om, we have to remember Om is nothing but symbol of God. That anahata dhvani, from where everything has come. That Om, which purifies our body and mind, helps to get identified with our real self. With this feeling, let us chant Om. Let that pure vibrations of Om go deep into this body and mind, which will help to meditate properly. Let us chant Om 3 times. Breathe in when you are breathing out. Chant Om. When you are breathing in, feel we are breathing in all that is energy, positivity, purity, strength. When you are breathing out, feel that you are throwing away all the weakness, impurities. By this, we are becoming more and more strong and pure. A strong and pure body and mind is very vital for meditation. Let us chant Om 3 times. Now let us proceed in our meditation proper. The place where we are going to meditate is deep within, the spiritual heart, just right to the physical heart, from where our bhavanas, feelings arise. Enter there deep within. The Anahata Chakra, the spiritual heart, the infinite space deep within. When you enter there our Ishtadevata, our beloved Lord, is already graciously present. Go and offer your Sashtanga Pranams to your Ishtadevata, Rama Krishna, Vivekananda, Kaliya, Hanuman, Jesus, Buddha, Allah. After offering your Sashtanga Pranams, receiving the blessings, be seated in front of him in Sukhasana, in Padmasana. Sthira Sukham Asanam. The focus is on the breath, deep and long breaths. We have entered our spiritual heart. We are with our Ishta Devata. We are completely focusing on our Ishta Devata, looking at him, waiting to hear to his words, just being with him. No other thought other than Ishta Devata. No other Nama Rupa other than our Ishta Devata. Now let us meditate on the divine qualities of our Ishta Devata. He is Parama Prema Swarupa, love personified, pure love. Love for the sake of love. He loves us. He wants us to be happy. He doesn't want anything in return. Parama Prema Swarupa. He is Sarvagya. He is the knower of everything. The present, past and the future. There is nothing that which he doesn't know. He is Sarvavyapi. He is present everywhere. He is the one who is always protecting us, guiding us. He is Sarvashakta. He is that highest energy, energy which can be neither created nor destroyed. That highest energy which runs this universe and everything is that energy, that strength, Sarvashakta. Let us meditate on these divine qualities. Parama Prema Swarupa, Sarvagya, Sarvavyapi, Sarvashakta. Let us dive deep within and meditate in silence and become a spiritual dynamo. Sthira Sukham Asanam. The focus is the breath, deep and long breaths. We are deep within in the spiritual heart with our beloved Lord, meditating on the divine qualities. Parama Prema Swarupa. Sarvagya, Sarvavyapi, Sarvashaktiman. Om Shanti Shanti Shanti. Harihi Om Tat Sat. Shri Ramakrishna Arpanamastu. Offer Sashtanga Pranams to your Ishta Devata. Take his blessings. O Lord, how lucky I am to be with you, to meditate on you, forgetting everything that's outside, forgetting even my own body. By your grace, I could meditate and experience that joy, bliss within. Please bless me so that I constantly experience this state of oneness with you. By taking his blessings, by promising him, I'll again come again to meditate and experience this bliss as soon as possible. Slowly come out, unwillingly. Feel your body, the focus in the breath. Slowly open your eyes. Meditation, dhyana, has a close relation to Omkaranada, Brahmanada, Anahata Dhvani, Spota, sound. All the thoughts that arise in our mind is out of Nama Rupa, the name and the form. Whatever we are seeing in this universe, Jagat, is nothing but different Nama Rupa, name and form, which is nothing but the manifestation of the unmanifest Brahman, God. अव्यक्त भगवान का, अव्यक्त ब्रह्म का व्यक्त रूप है ये जगत. So whatever the name and the form we are seeing is nothing but that God, Om. I also said every thought that arises is out of the name and form. And we also know meditation is the constant flow of thoughts towards God. So all the thoughts that arise should be originating from this Omkaranada. So when you constantly chant Om, all the Nama Rupa, name and form that you see, will automatically get identified with that original form, original sound, that is Om. So that's how Omkara has a close association with meditation. So constantly chant Om with that feeling. Chanting Om purifies the body and mind. A pure body and mind can alone do meditation proper. ध्यान अवस्था पहुंचने के लिए शुद्ध शरीर और शुद्ध मन बहुत जरूरी है. जहां मन और शरीर शुद्ध है, उस व्यक्ति, वो व्यक्ति सहज ही ध्यान अवस्था में पहुंच जाता है. ध्यान अवस्था एक सहज अवस्था है. Natural, our real state is state of meditation. So attain that purity, body and mind purity, we have to strive. For that, Omkara chanting helps a lot. And as I keep on telling, please focus on yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. The moral conduct. Ahimsa, satya, steya, brahmachari, pragraha. Shaucha, santosha, tapas, swadhyaya, ishvara, pranidhanani. If you want to meditate properly half an hour every day, 23 hours and 30 minutes. You should always be established in moral conduct. Take care of the body by doing asana, pranayama, by having nutritious food. Then constantly remember, you are not this body and mind but the soul. Shariram khalu dharma sadhanam. The effort we are putting to keep this body and mind fit is to realize our real self by using this body and mind. That is the purpose of this life. God realization, self realization should be goal of mankind, the highest goal of mankind. So let us do all our duties with responsibility, with the attitude of service to God, with devotion, with understanding. That's what yoga means. Yoga is way of life. So let us remember all these things. Practice every day, morning and evening, at least 30 minutes in the morning, 30 minutes in the evening. And try to lead a beautiful, healthy and happy life. Thank you. Namaskars.
Thank you, Swamiji, for the wonderful session. As we said in the agenda, I'll take a few minutes, and we are actually preparing to launch another important program. I'll just give a brief about it, and that is expected to be launched sometime middle of this week. So I'll just give a brief about it as a first, we are all life members, so we need to know what is happening in IWSP next course. So I'll just take a few minutes in talking about this particular course. This course is going to be self-help remedies for back pain and other ortho issues by Dr. Mrityunjaya. Many of you would be aware of him, and he is part of IWSP life member. Though he is not very regular, but he knows and he's in touch with us regularly. I'll give more about him. So why this course? Look at these statistics. This is what a reason for us to launch this course. Approximately about 1.71 million people across the globe has got musculoskeletal conditions. Among that, majority of them are having issues linked with back pain, almost about 568 million people. And the back pain is one of the leading cause for worldwide, the disability worldwide. Almost about 160 countries has got an issue. I mean, people have got an issue and become disabled because of back pain. These are all the statistics we have taken from WHO sites. And even this musculoskeletal conditions are one of the leading reasons for many of us, stop working, retirement from working. Imagine. So these are all, when you get older and older, this problem is going to increase too. But it doesn't mean this course is only for elderly people. Even to prevent and live long, actively, this course is important. This care is important more than the course. It's more of a care and knowledge is important. So these are all some of the reasons why we thought we should have a program handling musculoskeletal disorder without medicine again, with the asanas, exercises, certain basic therapeutic process. So this is the reason why we were interested in this course. And what are all things we are going to cover in this topic? The body is divided by Dr. Mrityunjaya into 3 different parts. The upper part, middle part, and lower part. These are all the list of courses. I mean, he talks about more of explaining what is that issue is and why it is causing, and then what are the basic simple remedy you can do on your own. That is the reason the name itself is called self-help. So all of us would have come across with one or two of these issues. Plantar fasciitis, Swamiji talks a lot about it during when he is doing the asanas. And the heel pain, knee pain, lower back pain for elderly as well as adult. And then cervical spondylitis, many of us undergo this, neck pain, shoulder stiffness, tennis elbow, and then wrist pains. So these are all the different areas where this course is going to cover. And this is Dr. Mrityunjaya, very close friend of all of us, including Dr. Sharma and Swamiji, and very passionate orthopedic surgeon who has a very strong liking, inclination, expertise in yoga, pranayama, dhyana, as well as physiotherapeutic, processes. You may see his qualification itself. We'll talk about it. He's right now a professor and head of Department of Orthopedic, JSS Medical College, Mysore. And look at his, contribution. He was a principal and founder of physiotherapy, section in JSS College, and he was almost leading that for about 6 years. He was leading the Department of Orthopedic, Occupational Therapy. And then he was a founder of Artificial Limb Center in JSS Medical College Hospital. And then JSS Physical Medicine and Rehabilitation Center also found by him at JSS Hospital. So he has a huge credibility in terms of his work and deliverables. And a very highly qualified person, M.B.B.S. at KMC, Mangalore, diploma in ortho at Gulbarga MR Medical College, MS Orthopedic in JSS Medical College, Mysore, DNB National Board, Delhi. Plus, he also did his postgraduate diploma in Johns Hopkins University. So very highly qualified, has a blend of both science and the ancient science, both combination of both. He has, like any our other panel of doctors, and he's also another admirable person who did this course for us.
So in the elderly, what is going to happen is, so in the active age, so activities is lasting only up to the 60 years of age. After 60, we feel we are retired and we have no other work. So you just land up. The vehicle which was moving suddenly stops. So we should never stop the movement in life. We have got to keep on moving. We have got to keep on actively working and maintain this posture. So in this study, what we are going to teach you is we will be teaching the science behind, the laws behind the structure. So how do we maintain the muscle? How do we avoid sarcopenia? Sarcopenia is a medical term used for the wasting of the muscle. Osteoporosis is the medical term used for the bones which have become brittle. So all these brittle bones, the wasted muscles, they can have tears or fractures which can just take away your life and more than taking out the life, you will have a very disabled, so very difficult end of your life. So that's why after there is nothing like a retirement. So we need to be active till the end of your life. So how to be active? And depending on our activity, we need to modify the day-to-day work. So you will not be so busy as you are there during your work. So in your own home, how do we chart out a simile? So how do we do a calendar of activities from morning to evening? What is done at what time? So when do we rest it? So these are all very important aspects which even the elderly can learn. And what exactly is degeneration? So what is going to happen for the elderly? All this will be scientifically told to you, and simple measures are taught in this course wherein you can have a better life, especially the retired life.
Yeah. So with this, we will also have a glimpse of, we just took one simple issue, predominant issue, back pain. So what he does it, how the course is going to be is an example of it. May take about 2-3 minutes time. Just have a look at this as well.
So lower back pain in elderly, the mechanism or the problems are totally different. So what they are in the elderly people, there is a lot of instability, there is a lot of wasting, there is weakness of the muscles. So this weakness of the muscles, if their activity has come down, that will lead to the instability in the spine. So if you see the whole spine, there are bridge like the small bricks. So they are held together by the ligaments. So it's almost like a flexible kind of a thing. So when it is flexing, when the movements are more, It has to have stability on the either side. The muscles have to be strong enough to hold those bones together. If the muscles become weak, now the whole tissue becomes, the bones will start moving in a haphazard way. Haphazard means not a very gross kind of a thing, it is a micro. So even that micro will lead to the instability. That instability which irritates the small nerves which are there very close to the bone. So that is the one which causes the formation or deposition of the extra bones in that to make the platform more wider. See, if you have a very small or narrow platform, so it is very unstable. But if you have a broad platform, so that is much more better, much more stable. That is how the body itself will create that platform and make the bone more broader, so that the bones which have become unstable are stabilized by the body. So in that process it forms new bones around that normal bone, and those bones, those extra bones are called as osteophytes or syndesmophytes. So this will block the nerve which is coming behind, and even the ligaments which are there, which are more flexible like elastic, they also become more stiff. And if the stiffness is there increases, the tissue structure of that ligament also becomes harder and harder. So many times even there can be deposition of calcium just to stabilize the whole unstable joints. So for that what we have to do is we have got to stabilize the joint, we have got to keep the muscle strengthening, so that these extra things which the body itself is forming to stabilize is not done. So what will happen if it is stabilizing, if you are not doing the exercises and the whole body is stabilizing the bone, these extra things will reduce the size of the spinal canal behind, and behind the spinal canal, inside that canal is the nerves. That whole nerve will get caught because of the narrowing of the canal inside. So that will lead to the numbness what you see in the lower limb. So if they start walking or stand for some time, the numbness will start developing in the lower limb. Lower limb, they are not able to walk, they have got to sit down and then stoop forward. When they stoop forward, the canal size to some extent will increase, and the nerve are relieved of the pain, and they will be able to take some more steps. That's why when you see a person of elderly age group who have already developed this spondylosis, when they are walking, so they have got to keep sitting for some time, and they just stoop forward to increase the spinal canal. So that's what happens in the elderly. So for them, you have got a specific exercise to strengthen the muscles in the front. So they have got to do all the exercises sleeping on the back, and not to do anything backwards, sleeping on the abdomen. So those videos will follow.
So this is how the program goes. I will also just give a glimpse of one of the exercise, that the exercise is not related to the back pain though, just to give an idea of how it is. It's for a different issue, but this is how the course is taught.
Okay, many of these foot and ankle problems are because of, as I told you, sitting in a very long duration with the foot and ankle downwards. So that will lead to the shortening of the calf muscle. So this calf muscle shortening, when you are walking, it will put more force on the forefoot, so near here, and they start developing pain in the forefoot area. So that is the problem why these foot and problems are more common, plantar fascia is more common. It is important to stretch this calf muscle. Very simple way by which we can stretch this calf muscle would be to use a step. Everybody has got a step like this with the railings. You can just, for the balancing, you can hold the railings. So stand at the tip of the one step downwards. So keep one leg on the other upwards. So for the balancing, just try to put entire of your weight on the limb. So important here is to keep the knee joint straight, the hip joint straight. So let the heel go down, let it go, let it go. So as you keep going, so there will be a lot of pain that you experience, especially if the calf muscle is very tight. So here have a more pain. If you are able to tolerate, go up to that area. If you are not able to tolerate, just move forward, the pain will disappear. Now you take the other leg. So go backwards, go to the end, and then just drop it down. So try to touch the lower ground with your heel. So try to stretch there. So try standing on that. So just keep on giving a small jerks there. Or you put your weight. Most important, as I told you, is to keep the knee joint straight, the hip straight, the upper limb straight. Don't bend forward. So keep it straight. let the weight, the whole of your body weight fall on the heel, and you should experience the pain in this area. So keep stretching. So especially this has to be done after doing the warm water, the foot and ankle exercises, which I told you. So then that will be very soft. The heel will be very soft, and you will be able to do a stretching much better. This is especially useful if you are sitting in the coach or in the computer for a very long time. So in between, you just go out, just stretch for 10-15 times, and then come back and sit. Your calf muscle will be in a good condition.
So this is just a glimpse of two different things: the theory, how it was taught, the knowledge, how it was given on back pain, and then for the other issue, how the basic simple exercise can be done at home itself. So this is just a glimpse of a few such things. So stay tuned, and we'll be launching it soon, sometime middle of this week. We need to have an internal discussion and then launch it. So we'll launch and then inform you through an email to all of you, as well as in the WhatsApp message. This we have Dr. Sharma on the line. Dr. Sharma, yes. So we as we discussed, we have few questions related to the stress management part of it. So I'll take a few of them, and anybody has got any other question related to stress or related to IWSP, we'll be happy to. Oh yeah, picture was crazy. Yeah, the course should not have this problem right now. Could be because of my internet connectivity. This may have a problem, ma'am. But that will be put in an e-module, so you will be able to see it properly. Not an issue. Sorry for this. Dr. Sharma, one question. A couple of questions came on stress management part of it. I think the person must be a doctor. There is a lot of connections between stress and mental health. It's keep growing. What is the connection? What is the reason behind this? And even we are finding difficult to make the patients to do those physical activities, though we are telling it is connected with stress and mental health, but we are unable to ask or push people, those people who has a problem, unable to make them to do a physical activity also. How do we handle it? You can enlighten us on this.
See, stress is a part of daily living. So we all have stress all the time. It's just a matter of how we experiment with it and how we learn from the experience that we develop from the experimentation. So some of those things are really practicing. And by practicing certain techniques, you see what kind of experience you get, what kind of feelings you get. And that is what teaches you how to cope with your stress in your own given situation. So one simple way of dealing with stress in an immediate way is what I call the immediate stress stoppers. For example, avoidance. For example, changing topic. For example, moving on to something else. For example, distracting yourself by reading a book, listening to music, a walk. Small things that you can do on a temporary basis. One very strong physical and breath-related practice that I recommend really is Anulom-Vilom, alternate nostril breathing. The whole practice has many components, and each component helps in its own way. When you start focusing on the breath, you clearly take your focus away from the problem that's giving you stress. So that is the immediate benefit. However, the greater benefit comes from the fact that you are actually activating your parasympathetic nervous system. So parasympathetic nervous system is the nervous system in the body that is related to relaxation, as opposed to sympathetic nervous system, which is related to activity and accentuating stress. So if you are running, if you are having faster respiration, if you're having faster breathing, then you're stimulating your sympathetic nervous system. When you're sitting down, relaxed, and focusing on the breath, stimulating your parasympathetic nervous system, that's what takes the stress away. So one way for people who have difficulty in learning any coping mechanism of stress, the simplest thing is you should do your Anulom-Vilom 3 times a day, 2 to 5 minutes, 3 times a day. If you make it a practice on a regular basis, even when you are not stressed, So this is important. All the practices that we recommend in our course for stress management don't work when you're actually having the stress, but they mostly work in preventing the stress and strengthening the coping mechanisms that help you prevent, mitigate, and cope with the stress. And Anulom Vilom is one of them. So the two of the strongest practices, Anulom Vilom, do it 2 to 5 minutes a day, 3 times a day at regular times. Second is your breath focus meditation, 5 minutes, 10 minutes, 20 minutes on a regular basis, and reflection. So that is what really strengthens your stress coping mechanisms. The other practices that we have recommended, for example, volunteering, connecting, belonging. If you have good social connections, if you have purposeful, meaningful activities of volunteering, helping others in life, and belonging to institutions that have more of an intellectual component where you sit with like-minded people and discuss good things. So that also strengthens your stress coping mechanism on a long-term basis. A few other practices on a short-term basis that help you cope with the stress is, for example, if you do japam, or if you do self-compassion exercise, if you try to prevent the negative talk in your mind, if you focus more on positive thinking, those are kind of things also help you cope with the stress.
So another question on the similar front, Doctor. Before doing all these practices, because all these things are not known to everybody, the 3x3 metric, we are learning it though. Is a medicine is the only way to handle the mental health which is linked with the stress, and is it going to be a forever, or is it going to be short term? How in general?
So we should make a distinction. See, the stress that has gone to the extent that it has now led to a mental illness is not part of the program. If you have a mental illness, or if you have an established anxiety or psychosis disorder, then you've gone past the stage where you can have self-help measures help you cope with the stress. In that situation, I think that you need the expertise of a therapist, psychologist, and a psychiatrist to deal with the situation.
Okay. Got it. I think the person should be a doctor handling some patients of this who asked this question. A personal question from my side, Doctor. The doctors who handle this stress-related or mental health-related sciences on patients, is it not going to be extremely stressful for the doctors too? Because day in, day out, they're going to handle only the people who come with thousands of issues linked with the stress, linked with the mental health. How are they? I mean, you maybe throw some light on this, how difficult it is for a doctor who handles those patients, for a therapist who handles those patients, and they also undergo a lot of stress, right, because of this.
Yeah, so I'll illustrate that with a different example. Some people can't even stand the sight of blood. Some people just go for a blood test and they see a needle and they pass out. They become unconscious. So they can't see the needle, they can't see the blood, and they pass out. Whereas we, the doctors, I mean, we are dealing with blood all the time. When we're doing surgery, there is bleeding, we stop the bleeding, we touch the blood with our gloves, of course. So I think that once you see these things on a regular basis, you develop a detached attitude. You know that you have to do the best. You know that you have to do what is best for the patient, and not let your emotion take away your cognitive process of thinking and doing what is right for the patient at that time. And this is just part of the practice. I think that is what we go through in our 5 years of training and 4 years of extra training. And all that training helps us to detach ourselves from the emotional responses to what is going on, and keeping ourselves calm and bringing in our intellectual capacity and the learning abilities that we've acquired over the years to help us treat and make the patient better. So I think all physicians go through that, and I'm sure the same way the psychiatrists go through that, and they detach themselves from the mental process of the patients.
Yeah, I see that is far more tough job than other jobs for sure. So another question which is a little away from stress, doctor, which came as well. Why are people develops the skin allergies for certain elements. When you apply something on your skin, some people it gets allergy, some people it doesn't. Some of the oil, some of the headache gel you are applying, it become allergy for few people is not. Is it anything linked with the skin, or is it anything linked with the individual body, food related? There are people who get food allergy also. So what is the reason for it, and how do we prevent it?
See, there is an innate mechanism in our body called immunity. So what that does is it tells your body to know what belongs to the body, what is acceptable to the body, what is harmful to the body, what is external to the body, and what should be rejected. The whole body is processed in that way. And if you apply certain skin things to your skin, which are foreign, which your body doesn't like, then it has its own way of rejecting. And that rejection process is the redness, the itching, the flare that you get there, or if it continues for a long time, you get the dermatitis or inflammation of the skin. So all that is body's way of telling you that whatever you're putting on the body, it does not belong to you and you should not put it. So this is a body's defense mechanism that gives you allergies. So what do you do then? Once you know that you're allergic to something, stay away from that. That's the best way to do that. And the more you live closer to natural, the more you avoid these extra things in your body, extra things in your food, extra things on your skin, the less you are stressing your immune system. And all these allergic reactions, all these dermatitis, all these flares, hives, itchings that you get on the skin, basically your body is telling you that you're putting something on the skin that you should not. It is basically the stress of the immune system, which is manifesting as inflammation on the surface of your skin. So your body is telling you, don't use it.
Okay. Okay. Yeah, I think, is there anybody who would like to ask any other question? Unmuting yourself. We have another 7 minutes to go. We can talk. Any general sharing, any general question, please do. We are open for that. Next 7 minutes. Anybody? You may raise your hand. Swamiji, you wanted to give any talk, anything? We have some more minutes to go. Swamiji, you are muted.
So one thing I have to say, Dr. Mrityunjay's presentation that's going on. So from the presentation, people should not really go away with the idea that all he's talking about is the elderly patients. Really, he's talking about the musculoskeletal disorders that affect us all at all the time. And the problem comes in when you get something acute. For example, you have a tennis elbow, you have a sprained ankle, or you have a fractured ankle. See, a lot of people, when you're walking on uneven surfaces, for example, right? And then you miss a step, or you somehow on an unlevel surface, or there is a stone that comes under the foot, and you bend the foot and you realize that the whole structure of the foot on the outer side becomes imbalanced. And I've seen young people, I tell you, about 8 to 10 weeks ago, we were playing cricket outside, and there's a young boy, he's like 32, and he was going for a ball, and he stepped on a pebble, and his foot twisted, and you won't believe it, he fractured his foot at 3 places. In the calcaneus, there was a fracture. In one of the small bones, there was a fracture, and the lower end of the tibia, there was a fracture. So 3 fractures in an apparently very healthy, young 30-year-old. And why is that? Simple reason. If you're not stretching these muscles on a regular basis, if you're not stretching these ligaments, the facial spaces, if you're not doing this on a regular basis, the relaxation, strengthening, stretching, flexibility, balance of these structures, very complex structures of the bone, the ligament, the muscle, and the fascia, they all work together, and the capsule of the joint, they all work together to stabilize the joint. So it's very important to know this and exercise every joint of your body. For example, Swamiji, when he does yoga, he does Sukshma Vyayama, these small bone exercises from the hands and the feet and the ankle. So you have to really warm up and exercise all the muscles. joints, ligaments, and fascia of your body, starting from your foot all the way up to the neck. And that is how you avoid these injuries from coming. And not to get frustrated, because once you get the injury, that's a different situation. So prevention is very important. And the great thing about Dr. Mrityunjay is that he combines the best of the ancient wisdom of yoga and the best of the modern science of orthopedic, and gives you the combined, the physiotherapy aspect, the prevention aspect, the treatment aspect. So really, it's a joy to listen to him, and it's for every age group. And I strongly recommend that you should also ask your family members and friends, and please join and do that, because the time to avoid a fracture, the time to avoid a sprain, the time to avoid all these injuries that come in the backaches, the neck aches, is actually now, not when you get the backache and the neck pain and all that. So please do join, and also call your friends, family, anybody that wants to join. The great thing about Dr. Mrityunjay is he will take you through the anatomy, then he'll take you through the physiology, then he'll take you through the mechanics of the joint, and then he will give you the exercises and the physio part and the yoga part that help you avoid those injuries. So looking forward to it. And I learned a lot on his last session, and I look forward to joining again. And thank you, Dr. Mrityunjay, and thank you, Dr. Naresh, to arrange this for all of us.
Yes, doctor. Just to share a quick personal experience. 2 weeks back, we had some physical work in our foundation. I started doing physical activity, all certain together. Suddenly, some 4-5 hours, a rigorous physical activity, my back pain started. I did not even call Dr. Mrityunjay. I just opened his videos. I started doing the recommendations, what he suggested, morning, evening, twice a day. It took me 1 week. I'm perfectly all right now. Nothing, no application, no band-aid, no medicine. I just followed whatever he taught in the video. I did it. I got 100% better. Yes, Swamiji, go ahead.
We have Muktaji.
1 second. I allow everybody to unmute if you want.
Mukta,
Yeah, you can unmute on your own.
is she there? She was sharing with me her reports. She was on statins for her high cholesterol. After practicing IWSP, she has reversed dyslipidemia. Her cholesterols are back into absolutely normal range, and she is off the statins. So, Mukta, if you are there, you can come and share your experience. Otherwise, you can share later next week.
Satish.
Satish, want to ask something?
Yes, Swamiji, actually I had a good experience with Dr. Mrityunjay. Actually, when I was working on completely on my research in the lab, I'm getting actually this muscles blockage and this heavy neck pain. Initially, I went into the doctor and he told take it X-ray and you have a generation of the spondylitis and fibromyalgia type of issue. Then I contacted Dr. Mrityunjay. He just guided me. He told me don't use any painkillers immediately. Let will see some exercise, small exercise. He just given as in me every day 3 times there is an exercise of the neck as well as hands. And then within I think maybe 10 or 15 days, completely gone out of that actually. Whenever anytime I was in a traveling back pain, but he's given another exercise. And I'm doing this Mandukasana and everything, then easily avoiding this. But really neck pain is last 3 years. People are told it is in a fibromyalgia, it may not reduce like that. But Dr. Mrityunjay is given only 3 trips actually. While working time, 1 time, morning and night. And permanently I'm not have anything of the issues. This is what I had experience with Dr. Mrityunjay.
Very good. Painkillers are the not solution for any musculoskeletal disorders. If you have pain in the body, whether it's muscular or it's something other, so the solution is IWSP, where we focus on the right activity, right exercise. So in our basic course, Sukshma Vyayama Asanas, that is the ultimate solution to keep every organ of your body fit, every muscle of your body fit. So if you do that, you will not end up in any diseases. And especially if you've got any musculoskeletal disorders, you must join the course as already explained very well in detail. And that course is a very comprehensive program, and especially focusing on disease and managing, avoiding all the painkillers. So that's what we recommend to all our IWS participants. Dr. Sudha Bala wants to say something. Yeah.
Swamiji, pranam Swamiji. I'm really grateful to Mrityunjay sir and Swamiji because I had a very severe heel pain and they were suspecting an autoimmune disease. So even though all the reports have come positive, with help of Mrityunjay sir, my pain has relieved a lot. So I'm very grateful to you all, sir.
Thank you for the feedback. So again, if you want to make a statement, big statement, if you go to specialist doctors, so-called specialist doctors, so-called modern medicine doctors, so-called evidence-based medicine doctors, so-called the consultant, so-called the super specialist in any hospital, which has become the trend. Who is the best doctor for this disease in this city? We go to them. What they do some several tests, diagnose with a disease and name you with that disease and advise some medicines. My dear IWSP participants, I think you are not for that. So all my IWSP participants who came with the right mindset to find a solution, permanent solution for all the lifestyle disorders and have got the benefit and they are experiencing the results. So I request all our IWSP participants to bring your friends and relatives to this program and let them also get the benefits that you are all getting. So again, to wind up, the basic thing is everybody must do the basic course IWSP. Everybody must do practice meditation with us every Sunday and also learn about new topics and question answers. And also the next program which is going to be launched is very, very useful. And especially you've got some musculoskeletal disorders, you must attend this program, your friends and relatives, and also the knowledge you are going to get. I think it's going to make you an orthopedic doctor, definitely. Please join the course and enjoy the health benefits. Thank you.
Thank you, Swamiji. With this, we will close our session and look forward to meet all of you in the next Sunday again. Have a great day. Have a good night. Bye. Take care.